us Professor Shaili Prasad, Professor Wael Reyes, and Professor Ahmed Mandil, who are the panelists. And Dr. Ahmed will also be moderating this very interesting session. So without further ado, Dr. Ahmed, if you want to lead.
Thanks very much, Professor Imara. And it's a pleasure and an honor to be with all of you this morning, afternoon, or evening, depending on where you are. And my name is Ahmed Mandil. As Professor Imara mentioned, I'm Professor of Epidemiology at the High Institute of Public Health at the University of Alexandria, and formerly Coordinator of Research and Innovation at the Regional Office of WHO in Cairo. So this afternoon, morning, or evening, we have eminent speakers, Professor Wael Reyes and Professor Shaili Prasad. And we have four main things to discuss. We were going to talk about the Global Health Alliance by Professor Imara himself, the Global Health Security Concepts and Applications by Professor Shaili Prasad, the role of global health security in achieving universal health coverage as per Sustainable Development Goals by Dr. Wael Reyes, and then joining us a little later would be Dr. Salia Samhouri. Dr. Dalia is the regional focal point for international health regulations, and hence her topic would be about international health regulations in a historical overview and impediments of implementation. So without further ado, I'd like to invite Professor Tamer Imara, Professor of Neurology at Ain Shams University and Director of the Ain Shams Virtual Hospital, to tell us a little bit about the Global Health Alliance in the South, and how was it put together, what it aims at, and what are its future implications. Professor Imara, the floor is yours.
Thank you, Professor Mandil. The Alliance for Global South Healthcare started as I would say, a natural progression of different sets of collaborations between academic institutes in Egypt, China, and America. And as a natural progression to what we've been doing in the virtual hospital, which is trying to improve healthcare development using technology like telemedicine in different parts of the world, especially in Africa. The Alliance is, at this point, is a collaboration between Fudan University School of Public Health and University of Nebraska Medical Center, the Center for Global Health Security, and Ain Shams University, represented by the virtual hospital. The scope of this alliance is twofold, looking at the challenges of the Global South healthcare from a policy and implementation sides. We have three focus areas, which is healthcare security, obviously the topic of this webinar, universal health coverage and how to optimize and maximize scalability and efficiency of healthcare coverage in underserved areas of the world, and digital transformation. We try to achieve this by looking at relevant priorities to the South, capacity building activities like this one and others to follow, inshallah, regionally focused research that tackles specific issues related to the Global South, and working on or supporting implementation projects to improve healthcare service delivery efficiency and function. I'll stop here and thank you, and looking forward to a successful webinar.
Thank you, Professor Imara. Could you please tell us a little bit about the different cadres included in such alliance, and whether you're looking at mid-career professionals to be included and support global health and global health security? Professor Imara.
Yes, the cadres present now are mainly, I would say, champions of change who want to see this this change happening as fast as possible, and who have been thinking about how global health is managed and looking at ways to maybe improve it a little bit. And we are open to definitely mid-career scientists to join us, and institutions also. So these are the three founding institutions, but by no means we are, it's a closed loop between the three institutes. It's just the start. And the reason of organizing events like this is to look at meaningful collaborations, and of course, among other values of this webinar. Thank you.
Thanks very much, Professor Amara. Today's webinar, ladies and gentlemen, is predominantly on global health security and global health, as well as international health regulations. Our first speaker this morning, afternoon, evening is actually Professor Shaili Prasad, who is the Professor and Carlson Chair of Global Health and Executive Director of the Center for Global Health and Social Responsibility at the University of Minnesota in the United States. Professor Prasad is going to talk to us about global health security concepts and applications. Professor Prasad, the floor is yours.
Thank you, Professor Mandel, and thank you, Professor Tamer Amara. This has been a wonderful opportunity for me to be participating in this. I'm really excited for the vision that you have set. Obviously, a lot of the work that needs to happen in global health is about developing long-term partnerships. So I'm really thrilled that you're setting the stage in this way. It's indeed a pleasure to share the platform here with Professor Mandel and Professor Al-Rais. I hope we'll have a robust discussion. My job today is to sort of set the stage for what today's discussion is. So I'm going to ask you folks to think about a scenario, probably about 500 years ago. And I'm asking you to do this because there have always been situations when microbes, particularly viruses, but microbes in general, have jumped species. They've started in one species, figured out how that species works, infected that species and spread. And eventually, somewhere down the line, one of those microbes, say a virus, decides either accidentally or otherwise, jump to another species. Now, about 500 years ago, if this happened, let us say this happened in a spot somewhere on an island in the Pacific. If there was nobody else, no other humans who went there, that virus stayed there. If it were suddenly exposed to other people who came by ship, it slowly infected new populations. And these new populations now, with the ships that they came in, went to newer shores and started infecting populations. This is an age-old story, okay? But here is one important difference. 500 years ago, it probably took them about 100 years to go around the world. The virus took a long time, and sometimes it probably died because there was no new host to infect. So the challenge we have right now is that if there is a new novel virus that jumps species and decides, oh, these humans are very juicy, we need to attack them, they go around the world probably in less than a week, or maybe a couple of weeks. This, I think, is an essential challenge we have. Now, we also have to keep in mind that there are changing circumstances. Why do microbes, viruses particularly, jump species? Well, opportunistically, right? And these opportunistic moments are more often present these days because of significant destruction of the flora, significant destruction of natural habitats, because of climate change, because of changing patterns of weather and other things where the chances of us humans interacting with other species is suddenly increased. And then the viruses are saying, okay, more food for us. It is in this context I want us to think about what do we do as a human species to prevent these massive outbreaks. I don't have to remind you of the current COVID era, the destruction it caused and the spread it did. Now, in this context, the premise of global health security becomes very important. Now, I would want us to step back one second because there have been some criticisms too, and we will talk about the criticisms in a minute. But the idea of a global health security is early detection, which means that you need health systems to be prepared to identify things early so that we can intervene at a very small stage before it starts infecting millions. We need to make sure that the health systems are strong enough to do that. We need to have a significant amount of cooperation between entities, either locally between one health system and the other, one clinic and the other, or between larger entities regionally and between countries. And then in the other part to keep in mind is that some of the challenges that we are seeing doesn't remain in the purview of one species. I had an interesting moment about 15 years ago. I went to a college of veterinary medicine here, and they started talking about, I am a human doctor. And then I had to think for a minute, oh, yes, I take care of only one species, where they, in the College of Veterinary Medicines, were taking care of hundreds of species, right? This is an important thing to keep in mind. We are not alone in this world. We are interacting almost daily, almost minute by minute in various forms with our surroundings, including various types of organisms and species and animals, right? So this is an important thing to keep in mind, because the premise of global health security will be incomplete if we don't talk about One Health, which is the premise of looking at all organisms, all species. And then the background of all of this is the premise of the planet itself, the health of the planet itself. So yes, you have to look at global health security in the context of this multiple layers. While at the root of it, while at the center of it, there is a heavy emphasis on infectious diseases, appropriately so, we have to keep in mind it goes way beyond that, because this overlay that we have of multiple species, of habitats, of the health of the planet. So I would ask us to think, and this is not a new concept, of the entire planet being an organism. And within this one big organism, the whole Earth being one organism, the interactions between the different entities are so dynamic, so complex, and so important that we have to pay attention to it. Now, I want to mention, we talked a little bit about the concepts behind the global health security ideas, but I want to talk a little bit, before I hand this over to Professor Mandel, about some of the criticisms. Number one, the origin of the word global health security traces back to some of the roots that started in 1851, the International Sanitary Conference. It was a very colonial enterprise. The idea then was, oh, those bad diseases, keep them far away from our shores. It was a very protectionistic approach. So you have to ask the question, is that still the case? And I can tell you in some cases, countries behave like that. I don't have to tell you about the complexities of inter-country relations, right? You folks are in the thick of many of the challenges there. Can you imagine having ongoing cooperation for health-related things? You would think that it's a normal thing for us to do, but it's not that easy. So the geopolitical dimensions, a lot of it vested in individual countries' interests, sometimes preclude us from the cooperation aspect of it, right? The second part of it, whenever there is an outbreak, there's a tendency for people to be very protective of themselves. If, for example, you consider the economic impact of COVID on US, there has been some estimates that the economy was affected by about $16 trillion. That is $16 million. So there is a tendency sometimes for individual units, individual countries, to be very protective of not spreading the information about what is new, whether there is a new outbreak or not. So that ultra protectionistic, particularly from a national interest / economic interest, might actually be one of the main problems we have in achieving some of our goals. The other part to keep in mind, one, my background is in primary care. I'm a broad scope person. So the question that comes up quite often is, are we right in approaching things from a single disease approach? Health is a much more than a very reductionistic biomedical concept. And while taking care of infectious disease is absolutely important, I'm not saying it is not, how do we then position the approach we have in global health security to the much vaster concepts around health for all? Now, this is sometimes a huge challenge, because urgency sometimes demands us to attack an individual organism, an individual disease. Whereas when you look at communities, you have to look at broad-based approaches. I'm going to give you another quick example before handing this over to Professor Mandel. This happened in Pakistan. Pakistan has had challenges in eradicating polio. And I was talking to a professor from Pakistan about some of the challenges about this. And the professor was mentioning is that the messaging we have is wrong. He showed me some newspaper items. This was about 8-9 years ago. And the newspaper photos had Bill Gates showing the polio drops. I'm not in any way trying to suggest that I'm critical of Bill Gates in this forum. I'm just suggesting the optics of it. Because a lot of people within Pakistan were asking the question. We have about 3 or 4 cases of wild polio every year. We have hundreds of motor vehicle accidents. We have so many people dying from floods. We have so many other challenges, including terrorist-related deaths. Now, why are we, or why is this white man so concerned about 3 or 4 polio cases per year? Now, you and I can rationalize why it's important to eradicate polio. But until and unless we understand the local context in which we present the importance of this, and why taking care of this in individual, while seemingly small situations, is very important, it is important for us to communicate that in a way that we recognize the importance of the solidarity across various countries, various communities. And going back to the spirit of what Dr. Amara said, I hope this cooperation will start bridging some of those gaps. Over to you, back to you, Professor Mandel.
Thanks very much, Dr. Prasad, for a global, regional, and national perspective of global health security. And you actually took us through a journey of time from 500 years to this day, which we really appreciate very much, and how the world has changed and how the microorganisms move much, much quicker than they did before because they don't respect borders and they actually move around in days, if not weeks or months or years, as you have eloquently mentioned. Thank you so much, Professor Prasad. The second speaker this morning, afternoon, evening is Dr. Dalia Samhouri. She is the Regional Manager of Health Emergency Preparedness and International Health Regulations in the Regional Office for the Eastern Mediterranean of the World Health Organization in Cairo. Dr. Dalia is going to reflect on the international health regulations in a historical review and also reflecting on the impediments of their implementation in a regional perspective. And this flows very naturally from the presentation of Professor Prasad. Dr. Samhouri, the floor is yours.
Thank you so much, Dr. Mandil. Just checking if my voice is heard.
Loud and clear. Thank you.
Very good. Thank you so much. And indeed, it's a proper landing from Dr. Shady just to reflect on what is the international health regulations. And it really come naturally after the background that he has given. So the international health regulations is or are a legal treaty or framework that has been in place for quite some time. It's not really a new one, but those regulations have been going through a number of revisions. And those revisions, they reflect the change that we are witnessing in terms of the level of threats that we're facing, but also the change in terms of the globalization through new threats that will be coming, but also the different structures in the different countries and how this will need to be taken into consideration in order to build a strong health security at the national level and at the global level. So if we would like to focus the talk for today, maybe we can talk about the latest version of the HR, which is the 2005, adopted in 2005 and came into force in 2007. And basically, they really a framework where member states are signatory of it. And by those regulations, they will have to build their national capacities for the early detection and response to the different hazards that will have an impact on the public health, but in a way that should not interfere with the travel and trade. So initially we look into public health, but at the same time, we have to understand and make the balanced approach or measures in order not to affect the travel and trade in countries, which we know that from an economic perspective, this is very important. The implementation for those regulations have been really taken different approaches, but also in their bigger perspective, countries that are still falling behind when it comes to meeting those regulations, including meeting the deadlines that initially set for the implementation. 2012 and then 2014 and then 2016. And then everybody realized through a review of those regulations and their implementation that the implementation of the regulation are a continuous process or processes. It cannot be defined by a time frame. The time frame has been put in order to promote the understanding and encourage countries to move in a quicker manner for their implementation. They really look into different areas of work, or if you want, in a shorter term, we use public health functions. They look into surveillance, they look into laboratory, they look into preparedness and response to emergencies, they look into antimicrobial resistance, they look into infection prevention and control. But also given the fact that the threats, they can come from different sources, not necessarily the known sources of diseases. They can be chemical, they can be radiological, they can be nuclear, they can be even climate change and their consequent natural disasters. All of them usually have an impact on the public health, and therefore we look into threats, not specific diseases. It's pretty much broad the way we are addressing or looking into them. Now, within WHO and as part of the support that we are providing to countries, is really putting guidelines for the implementation, but also tools to monitor and evaluate the implementation of the IHR. And initially, when we look into the implementation, and which mainly was through self-assessment by countries, we were under the assumption that the level of implementation was going pretty good. But when we were hit by Ebola back in 2014, and then the Zika came after that, and then other emergencies came after that, and of course the COVID, I think the realization was that the self-reported data, it provides an overestimation of the actual capacities on the ground. But at the same time, there are additional areas that are very important to consider and to work on to build the capacity of countries in order to be better prepared, which these were not initially included in the different monitoring and evaluation tools that we have in place. A lot of revisions have been taking place, but maybe a quick reflection, so I can give it back to you, Dr. Mandeep. Apart from the fact that we understand that there are a number of public health functions that we really need to have them in place, and those functions, they have to be in place at the different administrative levels of countries, but also at points of entries. One important aspect that we continue to forget is communities. We know that threats, they start at the community level, but also they end at the community level. And unless and until we take communities in the back of our mind in the designing and implementation, but also before the designing, in the actual assessment of capacities, in order to come out with a tailored approach that would suit the different communities, we won't be able to really to move significantly. And then the second part, and given the fact that we are looking into hazards that will be coming from different origins, this means that the health sectors, they are really playing a strong role, but they're not the solely sector that should take the responsibility of the implementation of the regulations. The role of the other sectors, and I think we have seen during COVID, for example, the travel measures, the trade-related measures, issues related to borders in their bigger perspectives. This all necessitated the involvement of Ministry of Foreign Affairs, Interior, Transportation, and so on and so forth. But at the same time, and given the fact that we are trying to build the multi-sectoral coordination in order to move forward in this area of work, we realize that there is a lack of multi-sectoral coordination, or in a better situation, it's not sufficient. And if we clearly look into the One Health approach that everybody has been advocating for, we need to implement One Health, and it's been ongoing, and it's been really on the different tables of the discussion and the different surfaces, if you want. But when you come to the actual implementation, it's not about guidelines, and it's not about tools, and it's not about identifying what exactly we need to focus on. It's really about bringing sectors together. And if we won't be able to bring sectors in a meaningful way where everybody understands their roles and responsibilities, it will be always hiccups in the middle, and it will be always incomplete picture. We've been doing a lot of evaluations. We've been coming out with a lot of reports and a lot of plans, but maybe one of the most important plans that countries have put in place that would gear the implementation of IHR is the national plans for health security. And those national plans for health security, unfortunately, they usually are underfinanced or not funded. And this is exactly another problem why we're not able to move strongly in this area of work. Financing preparedness is a critical element. Without the financing, I don't think we will be able to move. And when we talk about financing, it's not only about mobilizing external resources, it has to be also part of dedicating domestic resources, because we want to make sure that we are self-sufficient, and when we're not, we bring the external resources from outside to complement what we have. But this will necessitate that we identify exactly what we can do and from where we can bring the other resources. So these were many challenges that we have faced, which have led to the process that is undergoing at the moment related to a revision of IHR. And it's actually targeted revision, not complete revision, where member states are taking the lead in this negotiation process to identify specific articles that will need few revisions, hopefully that will facilitate their implementation, with the understanding that we still need dedicated resources, whether finance or a human, at the country level in order to move things forward and have a better implementation for the national and global health security. Back to you, Dr. Mandil.
Thanks very much, Dr. Samhouri. I'd like to add just that the International Health Regulations Treaty, as well as the Framework Convention for Tobacco Control, are among very, very few treaties the whole world has agreed upon. So for IHR, 196 states have actually agreed to implement them, but with the caveats which Dr. Dalia has referred to, especially when we're faced by major epidemics like Ebola, Zika, or pandemics like COVID-19. Since you are also the regional focal point for One Health, could you give us very, very quickly an idea about the 4 sectors included there? Thank you.
Thank you so much, Dr. Mandil, and you're really touching my heart with this area of work. It's one of the areas that is really close to me. Yes, I've been known to work for IHR or support IHR implementation for ages now, but One Health, again, is really taking a lot of attention at the moment, simply not because One Health has been on the surface back in the 80s or 90s, and maybe an official naming of it came, I think, in 2004, with having 3 organizations coming together: WHO, OIE at the time, which is at the time known as World Organization for Animal Health, along with the FAO, Food and Agriculture Agency. The 3 agencies or organizations, they came together, they actually formed something that's called the tripartite. And that was the time where everybody realized that to support the implementation of One Health, it really needs a bigger level of coordination, not only at the country level, but also at the organization level, regional and global as well. And when we look at the country level, this means that we need to make sure that the different sectors related to the interface of animal, human, and environment are there. The sector related to environment, I think the importance of it did not appear properly at the beginning, but due to the climate change, which everybody is feeling at the moment, and all the changes that we are seeing in terms of the pattern of diseases that are associated with this climate change and with the different natural disasters, I think it's a great recognition of the importance of the role of the environment, which made the tripartite to grow and become a quadripartite, with the engagement of the UNEP, which is the organization that is dealing with environment. Reflection of this is at the country level by having the different sectors that deals with agriculture, environment, animal sector, and human sector. They should be coming together in order to work or to foster the implementation of One Health. We have identified a number of areas where we can make a practical implementation of the One Health. But back to the point that I raised earlier, it's really about the multi-sectoral coordination. Because if you manage to get the multi-sectoral coordination, this means you will be able to have a collaborative surveillance. This means you will be able to have a timely information sharing between the different sectors and risk assessment and analysis in order to be able to identify signals that may lead to a threat that needs to be managed immediately. And this means that you have a collaborative laboratory for the confirmation. This means that you have a network of human resources coming from the different sectors who are able to work together jointly for the detection, investigation, and response. So my simple word always about any big move that we would like to achieve and the targets that we should achieve under the SDGs and others, it's really mainly cannot be moved unless we have a strong multi-sectoral coordination that would be able to move the process.
Thanks so much, Dr. Samhouri. And you actually mentioned Sustainable Development Goals. And Sustainable Development Goals, many of which are actually health related. It's not only SDG 3. Many of it has to do with the education, with the environment, with the climate, with the people around the world having a healthy lifestyle. And hence, the next speaker, Dr. Wael Reyes, who is a faculty with the Department of Health Service Administration and also co-director for the Center for Global Health and Development at the University of Nebraska. He will be kind enough to tell us about the role of global health security in achieving universal health coverage as per the Sustainable Development Goals 2030. Dr. Reyes, the floor is yours.
Thanks a lot, Dr. Mandil. Of course, my speak or my talk will be can't compare to what Dr. Prasad and Dr. Samhouri said, but I'll try my best. So, as Dr. Prasad mentioned earlier, I think this is an informative session, and we need to lay the foundations for some of the terms and initiatives that we are talking about. And what Dr. Samhouri just mentioned actually is a good segue to just talk a little bit and give a little background about Sustainable Development Goals or SDGs. So this is, again, I'll say that in my simple words, but this is the current global initiative to advance, I would say, every aspect of human lives across the globe. It follows decades of country level and the global level initiatives that started at least from the 1990s. There was a previous initiative called the Millennium Development Goals, or MDGs, that was approved or initiated in 2000. And this one mainly focused on eliminating extreme poverty across the globe by the year 2015. But again, with all what's happening globally, the UN initiated another, or the current initiative that was launched in 2015, and it's called the Sustainable Development Goals, or Agenda for Sustainable Development Goals, or SDGs. And this agenda should run until 2030, with the hope that they can achieve their goals. But that being said, and these are words, exact words from the Sustainable Development Goals website or information, they are described as supremely ambitious and transformational vision. Because as I will touch on later, it's very comprehensive and includes literally every aspect of human lives. And the vision is that there will be no poverty and no hunger, and to what we are talking today, no disease. They envision also a world with equitable and universal access to education and health care, and in the way to achieve physical, mental, and social well-being. The Sustainable Development Goals are 17 goals. Okay, within all of them, they have 169 targets. The one directly related to health is Sustainable Development Goal number 3. And within this goal, they have 13 target and means, if you want to say. But as Dr. Mandil mentioned previously, the rest of the 16 goals have directly related targets that relates to health. But as it's well known, those 17 development goals are very interconnected and interdependent. Okay. Within the 13 goals of the within the 13 targets of Sustainable Goal 3, which is health related, there are two points that are very related to what we're talking about. Target 3.3, which is infectious diseases, and target 3.8, which is universal health coverage. So again, as said by Dr. Prasad, Dr. Nadir, and Dr. Samhouri, the way or the main point in achieving those sustainable development goals are novel approaches. And one of the critical elements of those is the intersectorial partnership. And also relying on domestic and national capacities and assets. Okay, so that's for the sustainable development goals in general. The one that I just mentioned is universal health coverage, because this is a very big project, and it really depends on local assets and capacities. There are variable levels of achieving that across different countries. Unfortunately enough, the countries or the regions that are lacking in that specific part are Sub-Saharan Africa and some part of Southeast Asia. So that's regarding the Sustainable Development Goals. The other thing that relates to Dr. Mandil's question is global health security. Dr. Prasad gave a very interesting perspective and history of that, but just to, again, laying the foundations here, it's what does that mean actually? What is global health security, or global public health security as it's defined by the WHO? So global health security is generally defined as the capacities and infrastructure that can help the world detect, prevent, and respond to infectious disease outbreaks. Okay. Again, related to what the WHO used, public health incidents of global concern. Right. This is the term. I always, get confused about that. But anyway, so this is part of that. But what I want to mention here, and this is because I wear a couple of hats with health administration, but also with special pathogens and infectious disease. Depending on who you talk to, they have different definitions. Okay, so one that I mentioned, which is related to infectious diseases and outbreaks, and one is related to universal health coverage and health service provision, which is securing different health services to those who are in need of that. So if we merge that, and this is already mentioned in the Sustainable Development Goals because they cover both. They cover the infectious diseases and outbreaks, as well as improving access and securing universal health coverage to people around the globe. Of course, one of the main things related to universal health coverage is what they call catastrophic financial events, because again, health services can be provided everywhere if you have the means, which is the money. But this is not available to hundreds of millions of people across the globe. So the main purpose, and this have been an issue with universal health coverage across different countries, is that they focused on increasing the financial coverage, less focusing on building the capacities and infrastructure that actually provide and sustain health access and health provision to those who are in need. So again, the issue of how universal health, how health security can facilitate or expand or enhance universal health coverage is a very complicated and very deep question. But generally speaking, based on what happened over the past decades and all the billions of dollars that have been pouring into global health security, some of that, if it's directed correctly and utilized correctly, can actually improve universal health coverage through building capacity, training medical teams, and actually vaccination coverage and surveillance programs. So just to give an example, one of the studies that we were doing recently, I discovered, it was published a couple of years ago, but we discovered that, or I discovered that main funders, including government and Gates Foundation, as Dr. Prasad mentioned, invested or spent in African countries more than $120 billion over 17 years. Of course, this is a huge amount of money, and if it was utilized properly to build the capacities, not just focusing on global health security, definitely these African countries would have been more better prepared for different types of outbreaks. So I will not take more time because we only have like a few minutes for questions and answers, and thank you.
Thank you so much, Professor Reyes. I actually would like to ask Professor Amara, as director of the Ain Shams Virtual Hospital, how will digital health, telehealth, and telemedicine be helpful in achieving universal health coverage? The floor is yours.
Well, there are a couple of issues that can be considered answering these questions, at least the first two that come to mind, which is what we can do using technology versus what the regulations want us to do or allows us to do. For example, the simplest example is we can have, for example, a patient with hypertension in England, and he is waiting for 6 months to see his physician to get his hypertension under control. But there is a very good doctor in India who can manage him, and he probably needs only to see him online. He doesn't need to see him physically. And if we look at the outcomes of patients followed up by the British and the Indian doctors, they may be similar. And the Indian doctor is probably cheaper than the British, but that person is simply not enabled to see that Indian doctor. So this
You
is
mean less compensation? That's what you meant.
Yeah, less compensation. Yes, that's a better way. So these are regulations getting in the way of providing what we usually talk about, which is person-centered care. On the other hand, technologies like, for example, triaging, enabling people to lead healthy lives, encouraging people by giving them feedback to do more exercise, things that are preventive in nature, things that can help manage people with chronic diseases who are the majority of people walking on Earth as we speak at this point in time. By nature, they will eventually cross borders. The need for capacity building and improvements is what is bringing people from different countries to this webinar to try to think of what we are doing and if it makes sense to them. So this balance between what technology can do and what the regulations allow, how reimbursements, credentialing doctors, we can go through all the details, I just don't want to take too much time, is, I think, a key factor to consider when discussing this point. Thank you.
Dr. Amara, there is a question in the chat box from Dr. Basma Mohsen Ragab Tulba. She's asking how could young physicians join the Ain Shams Virtual Hospital, and is there a special application form, whether within or outside Egypt? The floor is yours.
There are many ways to join the virtual hospital team. If you want to join as a practicing physician, we have to look at your credentials, and you can do that. If you want to join as a team member, trying to help us in what we do in our day-to-day work, which is looking at needs for the Global South and how we look at projects to improve healthcare services delivered to people in underserved areas, looking at projects, collaborations, capacity building work. We'll be more than happy to get in touch with you. I can see that Huda has already shared our virtual hospital email with you, and we'll be very happy to get in touch.
Thank you. Dr.
Thank you for
Dalia,
your
please.
interest, of course.
Of course. Dr. Dalia, please, if young health professionals from different parts of the world wish to actually join WHO without applying for its full-time posts, are there other ways for them to be on board for short periods of time, to build their networks, get to know people, get to know what WHO is doing, and so on and so forth? What mechanisms are there, please?
Okay, so joining WHO, there are, of course, so many different ways. One of them is to join as a staff, and that will be competitive process where advertisement will be made and people will apply and go through the process. But also as a service, some people can join WHO in the capacity of consultants or in the capacity of UNVs, which are the UN volunteers. The process is different from one to another, but it always has to be competitive in terms of your application and whether it meets the criteria and the experience that are required and the level of education that is required. And then usually the screening process takes time along with written exams, sometimes interviews, etc. There is one modality also that's called fellowship, where we also bring fellows from different countries to get to join WHO in that capacity. And again, it has its own rules. But that's an opportunity for people to take short leave from their jobs and to join WHO in this capacity, to learn, to get experience, etc. But knowing that joining WHO is not that easy, because, you know, as we always say, there should be a vacancy or a need in order to be able to bring the service that will need to be provided to meet that need. So, and because people usually, they are already engaged in different positions or different places, WHO makes available some open WHO courses, where a number of courses have already been advertised or are in place in the public domain. People can get to enroll themselves in these courses, which it really can help them to advance their knowledge related to specific areas. But that will be from a knowledge perspective, while from a job perspective, they will have to follow advertisement. So it's not that easy, I would say. Yeah, sorry.
Thank you very much. So you actually reflected to internships, UN volunteers, consultancies, en route to international competitions for advertised positions. Thank you so much, Dr. Dalia. Dr. Prasad, sorry, please,
Dr.
Dr. Wahab.
If I may follow up on Dr. Dalia. So I don't know, the question is the person was seeking the diplomatic passport or just interested in public health work. But anyways, if they are interested in public health, there are many international organizations that work in that field in the US, in Canada, in Europe. So if they're interested, that can be a way to fulfill their passion and might be a way for WHO later on. So.
Thank you so much, Dr. Reyes. Dr. Prasad, there is a question from Dr. Maha Fathi. She's mentioning that the global health security is concerned with detection, prevention, and response to health emergencies. Without detection, we can't respond or prevent. Early detection needs advanced diagnostic techniques, which are lacking or lagging in most of developing countries. So her question is, how could global health security efforts overcome such a burden or a hurdle? Dr. Prasad, the floor is yours.
Dr. Mandel, that's a wonderful question. Yes. If you look at the history of medicine, right, we started with good clinical sciences, developing into really good laboratory sciences, and the laboratory sciences advancing quite significantly, particularly in the last 3 decades. This is a very critical point because quite often when you have, if you go back to even 30 years ago, when you had a viral infection, there was no way for us to really detect them until and unless we did acute and convalescent sera for antibodies, and that took about few weeks to early detection of maybe 1 or 2 viruses. Now we have gotten to a point of being really quick in diagnosing pretty much anything, and one can make a case that we have the technical capacity, the technological capacity to do whole genome sequencing of a novel virus pretty quickly. Now, the key question here is that available at where it's needed the most, right? So, Dr. Samhuri very elegantly put the point about early detection and how it's important to contain things at a very local level before the spread occurs. For that to occur, yes, we can do the universal precautions, et cetera, but if it's a novel virus, for example, you need to be able to identify it in a very quick way. So availability of this technology at a local level is a huge question. Some of the efforts within global health security has been about building laboratory capacity across various parts of what are considered hotspots, where a candidate virus might be able to jump more quickly. We're not going to put this in Greenland, for example, right? So this is an important thing that needs to occur. The follow-up of this is a critical question too. The investment needed for this, the financial investment needed for setting up advanced technological capacity is a critical question, because where are the priorities at the local level? If you have an increased burden of childhood diarrheal diseases, for example, which is not as cost prohibitive to treat and very important to treat, how does a country prioritize this? I think this is an essential tension that needs to be balanced. Thank you for that question. That's a wonderful question.
Thanks, Dr. Prasad.
Dr. Manil, if you allow me just to elaborate a little bit on this question, which is absolutely great, and I think Dr. Shady managed to put the fundamentals related to it and to highlight the technological advances that we have been going through, including the genome sequencing. But maybe because we've been doing the evaluation of this kind of capacities in countries, and I would really like to put it in its bigger perspective. I think it's very important to understand that the majority of the countries in our region, they do lack such advanced capacity, if you want. And unfortunately, the advances that we made during COVID are not being sustained because of the lack of finances, and some of those gains are really falling apart somehow. 2 things that I would like to highlight here is that the laboratory component is part of a bigger system. So that technological advances is absolutely important, but we really need to have the brain behind it. So if we fail to invest in human resources, and particularly those who are doing the sample collection and packaging and sending it to the laboratory, you will not get the right reading that you're looking for. But also when you are doing the reading, you might not be able to do the right interpretation that you're looking for. And sometimes, in addition to the fact that we need those greater human resources, and we need to find so many different mechanisms and how we can invest on them and how we can return them, because we know that this tendency of leaving countries and going to find jobs in different places, leaving vacuums in countries, it's pretty much a trend in this part of the world. One thing that we need to find mechanisms on how to do the investment in the human resources and keeping them, but also when we fail to find, or maybe when resources are not really available to continue to advance in technologies, one of the things that we've been advising countries to do is to have actually agreements with other countries in a way that those samples can be shipped and the testing can be done, and therefore the resources can be used for something different. So let's just to think about the early detection, that it's not only about the lab, it's a bigger system, but also how the country itself is able to make arrangements with other countries in order to meet some of the gaps that might be difficult for them to meet in a short term or on a shorter timeline somehow.
Thank you, Dr. Dalia. We have a question for Dr. Wael from Dr. Huda Wahba. She's asking you, how important is it for physicians that are not in admin positions to know about global health security? And do you think this knowledge can affect the overall impact of countries' readiness? And I think this will be the last question here.
Okay.
Thank you.
This is a great question. And of course, there are numerous websites and numerous resources all over the internet for those who are interested in global health security. You can't keep up with all what's going on. So that's one thing. The other thing, there are different organizations that actually can be affiliated with that work in that area, and definitely, and there is a huge need in that regard. The other thing is definitely, as we mentioned previously, improving awareness, national awareness or local awareness regarding different components of health security will definitely enhance the overall readiness and preparedness of countries. That's out of discussion. But I just want to take the last 2 minutes and go back to what Dr. Dalia mentioned, and I have to add to that political willingness, security clearance, willingness to share information with other countries, because I'm not going to name countries, but based on our experiences, these are major challenges, and governments actually oppose, not even they are not neutral, they oppose sharing and getting support and technical support from other countries and other organizations. So I'll keep it at that.
Thank you, Dr. Wael. For Dr. Imara, and as we close, because I'm moving to another meeting in just 2 minutes, a question from Mr. Muhammad Noor is asking if data security, cybersecurity, and cross-border data is part of the global health security. The floor is yours.
I think by default, and as Dr. Wael just mentioned, that yes, we just have to think what we want to happen versus what is happening versus what others want to happen. But technically, yes, it should be. I mean, when and how, and the mechanism and the how to keep everything, of course, private as much as possible, but then looking at privacy and also looking at value. So how much risk are we willing to take to save some lives is an interesting question. But yes, technically, of course, it's a big part of what global health and global health security look into, not only infectious disease, but all kinds of them.
Thank you so much. At this point, I would like to thank Professor Imara, Professor Shaili Prasad, Professor Wael Reyes, and Dr. Dalia Samhouri for a wonderful session. Your contributions are well shared, well appreciated, and also I have to thank each and every participant in this webinar. Ladies and gentlemen, thank you very much.
Thank you. Thank you very much.
Thank you. Bye-bye.
Bye.